morning. We're back. I'm Kathy.
And I'm old enough to be your mother.
Yes.
But my other name is Leslie.
And we are pharmacists with a keen interest on smoking cessation. So today we thought we'd take the chance to really bust some myths when it comes to smoking cessation. You know what, we hear this all the time, and I think it's very unlikely that we have someone that actually quits for good on their very first try. The evidence actually says that the more that you try, the more likely that you're actually going to be able to quit. So I'm happy when people come to me and say they've tried multiple times in the past, because they're probably good and due for a quit.
So what you're saying is the only failure is when you stop trying.
Absolutely, Leslie.
I'd say smoking is definitely not a bad habit. Smoking is an addiction. It's a powerful addiction to a substance called nicotine. And that's why it's so hard to just stop. When you have a cigarette, you go into nicotine withdrawal in about 45 minutes. And that makes you want to have another cigarette. And you know what, Kath? If you smoke a cigarette every 45 minutes to keep out of withdrawal and you're awake for 16 hours a day, then you'll smoke 20 cigarettes a day, which coincidentally is how many cigarettes they put in a pack.
Sneaky.
Yeah. Coincidence? I think not, little puppy.
No, definitely not. So I think it's important that we do recognize that it is an addiction, and we need to start blaming the cigarette and not the smoker.
I totally agree. It's not a character flaw. It's not because you're weak. It's the addiction.
Okay, I have to disagree there. If you quit cold turkey, your chances of actually successfully quitting are only about 5%.
5%?
5%. So it's pretty dismal. I wouldn't go betting on those odds. And, you know, when you quit cold turkey, you can have pretty significant nicotine withdrawal, right? So you have nothing there that's helping you ease the pain of quitting. And those nick fits, as people rightfully call them, are pretty brutal. So, you know, your chance of actually success with quitting is pretty low, and it's going to be pretty uncomfortable. So, when you use quit meds like varenicline, bupropion, or nicotine replacement, you're actually increasing your odds of successfully quitting to 20 or 30%. So, you know, 4 to 6 times that of cold turkey. And you're much more comfortable because, you know, you do have that medication there to help to ease the pain.
So, if I use a quit med, this whole process will be a lot more comfortable.
Absolutely.
And I'll be more likely to quit.
For sure.
Makes sense.
Absolutely.
Yeah, I hear that one from smokers all the time. It's understandable, but there's a couple of things I guess I want to say about that. So, first of all, nicotine from a nicotine replacement product is not anywhere near addictive as nicotine from a cigarette is, and that has to do with the fact that it enters your brain way more slowly, and the faster things get into your brain, the more addictive they are. So, highly unlikely you would get addicted to a nicotine replacement product. The other thing that I want to say is that these products just contain nicotine. And nicotine for adults is not the harmful part of the cigarette. It's just the addictive part. The harmful part is the 7,000 other chemicals that are found in the tar. And those are the things that are giving heart disease and cancer and lung disease and all sorts of things like that. So if you take a nicotine replacement product, you're just getting the nicotine without the harmful ingredients. And usually most smokers only need about 12 weeks of treatment. Some need a little bit longer, but then they can stop it.
No, not likely. It's perfectly fine to smoke with the patch on.
Oh, okay.
Yeah, so, I mean, it's obviously not the intention. At the end of the day, we want to be smoke-free. Obviously, we're using the patch to help us quit smoking. But if you have a really bad craving and you give in and you have a slip, not the end of the world. If you have a slip while you're wearing the patch and you smoke a cigarette, it's just like having one extra cigarette on top of your pack when you're normally smoking. So it really doesn't make that much of a difference.
You know, when you say it like that, it makes sense.
Yeah.
I don't worry about having a heart attack just because I have an extra cigarette.
No, and I mean, 20 versus 25 doesn't really make that much of a difference. Same thing here. And also, if you have that slip and you take off your patch, your chances of, going right back into fully smoking again and relapsing are really high. You're taking away that safety blanket.
You'll probably have a heart attack for sure then.
Yeah, I mean, you keep smoking, you're more likely. And also, using the patch as a quit aid and actually smoking on top of it has actually been recently approved as a method. So what you actually do is put the patch on as a pre-cessation method. You pick your quit day, you put the patch on 2 weeks before, and actually smoke on top of the patch as a way to try to help you cut back on your smoking.
Yeah, so in those days leading up to the quit date, do I keep smoking the same amount, or
no,
what do I do?
You certainly use the patch as, a little bit of help to help you cut back and do a little bit of a reduce to quit method.
I say with great confidence that that's very unlikely. And what gives me the confidence to say that is a study that came out a couple of years ago that actually compared Champex with all the other quit medications and with placebo or sugar pill.
Okay.
And this study looked specifically at the sort of what we call neuropsychiatric endpoints. So things like agitation, depression, psychosis, mania, suicidal or homicidal thoughts. And what the study showed was there was absolutely no difference between any of these products and placebo.
Right.
So I know now, or I feel much more confident in prescribing these medications, even in people who have assorted mental health diagnoses, as long as they're stable. Because obviously you don't want to start smoking cessation anyway in somebody who's acutely depressed. It just wouldn't be a good time.
Right. So I think it's one of those things that people believe. They may have read it on the internet. So
yep, it is all over the internet, and in fact there were even warnings called black box warnings put on these products to let health professionals know about the concerns, and since that study was published, those warnings have been removed. So I think we can all feel a little bit more comfortable now about going on Champex, which is great because it's a very effective quit medication.
Yeah, and I think, the proof is in the pudding, as they say, in the sense of that big trial. The Eagles trial really, proved what we thought to be different.
Yeah. Now, you still will see those warnings on the internet.
Yes.
But you guys all know better than to believe everything that you see on the internet.
So, we've certainly busted 6 of the common myths when it comes to smoking cessation. So I hope we've alleviated some of, people's concerns out there when it comes to smoking cessation.
I have to say, Kathy, it's been a real pleasure driving around with you this morning instead of working. And I want you to know that I think you'll make a satisfactory smoking cessation pharmacist.
Satisfactory, Leslie. That's a compliment coming from you.
High five.
Careful.